Good afternoon, everyone. A warm welcome to Healthcare Scholarships Roundtable discussion session. We are very happy that you are able to join us to find out more about healthcare scholarships and the disciplines. Today, for the roundtable discussion, it will help you better understand the different healthcare disciplines to help you make an informed career choice. It will start off with a short sharing sessions by each of our professional representatives, following which we'll move on to the Q&A portion. At any point of time, please feel free to post your questions through the Q&A button on your screen. So our roundtable discussion session will be joined by Ms. Sarah Tan, Diagnostic Radiographer from Fong General Hospital, Ms. Hannah Leong, Podiatrist from Woodlands Health Campus, Ms. Nava, Senior Staff Nurse from National Heart Centre Singapore, and last but not least, Ms. Felicia Lee, Senior Occupational Therapist, St. Luke ElderCare. So without further ado, Sarah, please start with your introduction.
Hi, good afternoon, everyone. My name is Sarah. I'm currently working as a radiographer in Fong General Hospital. Just to share a little bit more background about what we do in radiology, we're essentially the eyes of the doctors because we help to take medical images of the patient's bones, tissues, and organs in order for the doctors to find out what is the root cause of the patient's condition. And this will help to ensure the timely and correct patient treatment that can be administered so that we achieve the best possible outcome for our patients. There's more to radiology than just x-rays actually. So we have CT, MRI, nuclear medicine, and ultrasound. And it's my passion to serve patients, and I enjoy photography, and that's why I chose radiography, because it was the best of both worlds for me.
Okay, followed by Ms. Hannah.
Hello, good afternoon. I'm Hannah. I was awarded the MOH Healthcare Merit Award back in 2015. I started studying podiatry at the University of Southampton in UK the same year, and I graduated in 2018. I've been working as a podiatrist for a little over 2 years now. I'm employed by Woodlands Health Campus, which is the new hospital coming up in Woodlands. But as you know, the physical building is not fully completed yet, so I'm currently nesting at Khoo Teck Puat Hospital. Both Woodlands Health and Khoo Teck Puat is under National Health Group, which is the NHG cluster. So a little bit about myself and how I got into podiatry. Maybe we can go back to the previous click. Yep, so that's a picture of me back in school. I used to dance competitively back in secondary school, and I developed some knee pains. My physio referred me on to a podiatrist who gave me some insoles, taught me some taping techniques, and my knee pains just miraculously disappeared. So I was very impressed by the professionalism of the podiatrist and how he explained my condition in a very scientific way. So after A-levels, I went to find out more about podiatry. I applied for the scholarship, and here I am. So next, this is a more recent picture of me at work, and next. Yeah, so this is a bit of a meme about podiatry, which will give you a clue about what I'm going to be talking about next slide. Okay, so now I'm going to be talking a bit more about podiatry. What is it about? I think most people won't really know because it's a bit of an obscure profession in Singapore so far. So just a bit of a warning, there'll be a few pictures of manky feet shown later. So if you're squeamish, you might want to just brace yourself or look away. So as you know, podiatry is about the feet. So there are three main overarching domains in podiatry: general treatment, high-risk foot, and biomechanics. But if you study more into it, these three areas are actually not exclusive. They're actually interconnected, and they do overlap in many ways. So general treatment, there are problematic nail and skin conditions such as ingrown toenails, geriatric, thickened toenails, callus, corns, hard skin, verrucas, that sort of thing. High-risk foot, when we talk about high-risk foot, we talk more about diabetic foot conditions. So a lot of foot ulcers, deformities, partial amputations, post-op wounds. And biomechanics is a little bit of the more glamorous side. It's how I got into podiatry. It's on foot pain, things like plantar fasciitis, sporting injuries, things like that. So yeah, this is a bit of a introduction to podiatry. That's all from me.
Thank you, Hannah. And followed by Ms. Nava.
Okay, hi everyone. So I'm a senior staff nurse at National Heart Centre, Singapore. So yeah, so basically for me it was purely God's calling to become a nurse. Never had I imagined to be one actually. I took a leap of faith, and only after I stepped into nursing school at NUHS in 2011 when I realized that my calling wasn't going to be an easy road. Everything was very new to me actually, and every failure in the nursing school actually enabled me to become more confident. Entering Heart Centre in 2014 as a newly passed out staff nurse posed its own fair of challenges. Facing such ups and downs made me acknowledge that I'm a human too, and truly every mistake was a learning lesson which made me stronger. My desire for nursing and people in general grew more over the years. After a good 4 years into this line, actually, I became a bit stagnant in my career. So I felt that I needed something to just push my limits even further. And so I decided to take up advanced dip in medical surgical nursing. This course made me understand not only the importance of holistic care and critical thinking when attending to the needs of my patient, but it also kind of like reignited the passion that I had for nursing right from the beginning. So it reminded me the core reason why I became a nurse and my calling to love and touch the ill. So my last slide, actually it shows just before the COVID, we were kind of like without the mask. And after the COVID, as you can see, we're just like, trying to get everybody around Singapore and around the world to wear masks and to stay safe. So I've been working for 5 years now as a staff nurse, and I simply cannot express the kind of joy that I experience upon seeing the smile on my patient's face. That alone actually can make my day. Even a small thank you from them is just very heartening and just keeps you going as a nurse. And in the next few years, I really hope to actually further hone my clinical skills as well as attempt to venture into the education line. Last but not the least, many would say that only certain people can become a nurse, but I always believe that actually anybody can be a nurse so long as you have the love for people and the love to touch another person's life. So yeah, thank you.
Thank you, Nava. Followed by Ms. Felicia.
Okay, so hi, my name is Alicia. I'm an occupational therapist. So I've been an OT for about over 10 years now. So I worked in both the public health sector as well as in private practice. Had the privilege of covering community hospitals, nursing homes, home therapy, as well as have been an associate lecturer in HMI as well. So for now, I'm in a daycare day rehab setting in SLEC ElderCare. I like to stay in the community setting because it's the setting that affords me a lot more time with my clients. So what exactly is OT? If I sum it up in 2 words, it would be meaningful occupation. That's why the name occupational therapy. So next slide. Next slide. Okay. Yes. Oh no. The second. Yeah. Yes. So to me as an OT, it's important for me to know which occupation brings meaning to my clients. So it may be to dress independently again, it may be cooking for their family, or and because of my clients, they usually consist of mainly retired elderly. So sometimes it can be just leisure activity like art and craft, gardening, housework, and maybe even driving, or shopping. Yeah, so I get to do all this fun stuff at work. So yeah, sometimes I get to see younger clients as well whose meaningful occupation is to go back to work, which is also great. Yeah, so basically what I do is that I would analyze the activity as well as my clients' fine motor and cognitive deficits, and I would try to bridge that deficit gap. So we usually work on the deficit gap, the deficits first, sometimes individually, sometimes in a group, depending on the task requirements and the client's preferences. And we also get to work with community partners like PTSH, driving rehab. If the clients can go back to driving because maybe they were drivers before, or refer them to sheltered workshops with, say, maybe STD, where the client can receive further training if they're deemed suitable to return to work. However, next slide. However, if let's say the client has really reached their maximum rehab potential, then we would have to modify their environment. So the environment consists of a few different types. It can be a physical environment, the social environment, or emotional environment, right? So in terms of physical modification, we can give them like a pen holding tool if they've lost the ability to hold on to a pen, gripple of pen because of decreased active range of motion in their fingers. Or another example would be working with the EASE program to install red bars and ramps in the client's HDB flat. And for some clients, maybe they would need, if they're eligible and they need other devices, they can even work with AIC to help subsidize items like wheelchair by up to 90% of the cost price using the Senior Mobility Fund. Yeah, so after they've gotten the power mobility device, we would even go to their house and see whether they're able to skillfully use it, or maybe they need to modify their social environment by training out their caregivers to work with them. Yeah, so yeah, even during the COVID-19 period, we even did tele rehab to connect with them. Yeah, to let them know that we are still care for them, and that they are, to encourage them to do their rehab and that their hard work will pay off. So maybe I'll leave you with my favorite quote as an OT, by this OT named Mary Riley, that man, through the use of his hands, as empowered by his mind, can change the state of his health. Thank you.
Thank you, Felicia. Thank you so much, Sarah, Hannah, Nava, and Felicia for your insightful sharing. So now we have come to the Q&A portion. We have already 3 questions in the Q&A. So for anyone who has any questions, please feel free to type it into the chat and we'll answer them shortly. So I think the first question that we would like to pose to the panelists is, Nava and Felicia, you mentioned about COVID-19 and how it has changed how you have, how the work processes in the healthcare setting. So this question is, how has COVID-19 affected the healthcare landscape in Singapore? And thereafter, the employment opportunities for doctors and other healthcare professionals in the future. So Nava, would you like to take this question?
Okay, yeah. So I think, okay, so basically, to really explain what actually happened in the hospital during COVID-19 was basically there were some wards that was allocated to be the wards that would take up these COVID-19 patients, and those wards, there will be the so-called clean wards where we have patients who are not ill with COVID-19 and will be coming in for like emergency cases. So when that was happening, so that's one of that thing that hospitals were doing so as to not mix both COVID-19 and so-called non-COVID-19 cases together in the hospital. So apart from that, I mean, the practices that were in terms of nursing and medical was basically very, very stringent infection control practices, especially not only just hand hygiene, which usually we will encounter in the hospitals, but more than that, like cleaning, really thorough cleaning every now and then. Even nurses had to do on top of our housekeeping, who also helps us in that. So I think in terms of this question, affected the healthcare landscape in Singapore, is there any, I'm not sure if the one who posed this could be more specific in terms of what you're referring to. But in terms of maybe the second part of the question, which is employment opportunities, definitely the employment opportunities are very widely available, like, especially for healthcare professionals, be it allied health or anybody for that matter, whoever is in this panel, as well as doctors, is always widely available, because we can never run, in that sense, a shortage, because we always need manpower. So we always need people, yeah.
Thank you, Nava. Felicia, would you have anything to add to this question?
Yeah, actually, how I see it has changed the healthcare landscape is that now the elderly, they are more open to learning how to do exercise online. So previously, would prefer for us to be right in front of them. They want us to, give them this, some physical guidance. If not, they would tell us it's too difficult to do. But because during the COVID-19 period, we couldn't do that, most of them were happy to just sit in front of their screen and learn how to do the exercise while just facing the screen. So we don't actually have to be there. And a lot of elderly actually learned how to use Zoom, which was quite good. So they also learned how to communicate with us over Zoom, and that's how a lot of tele-rehab was done. Sometimes maybe even also using WhatsApp. So previously they were very close to the idea, but COVID-19 opened their minds.
Thank you so much, Felicia. Moving on to the next question for Sarah and Hannah, as you guys are MOHH scholars. So this question is, hi, thank you for sharing. What traits do you think scholars should have? So maybe Hannah, you can take the lead for this.
Hi, yes. So I think most importantly, you need to have passion for the job. First of all, you need to find out what the job entails, what would it look like on a day-to-day basis, and see if it's a good fit for you, what kind of career you are looking for. So for me personally, I wanted something that was fulfilling, something meaningful, and at the same time, I also wanted a job that will allow me to have time for family and for other personal growth. So I didn't want to choose something that would involve a lot of shift work where I'll be away from my family a lot. That's why I chose podiatry. So podiatry is mostly office hours and minimal weekend work. So it allows for a very good work-life balance. And I think most importantly, you need to understand the job role and if it is suitable for you. I feel that is most important. Of course, you need to be passionate about it. You need to have compassion for other people, be caring, and yeah, basically that. Sarah?
Thank you, Hannah.
Okay, so for myself, unlike podiatry, radiography actually involves a lot of shift work. So I actually just came back from my shift. During my time as a scholar and even now, I feel like it's more than just serving a bond or having your career planned out for you, because being in the healthcare industry really calls for passion and a heart of service. So even when you start work itself, no matter which industry you're in, but especially in the healthcare, I feel like because teamwork is a very important part of our career itself, so we need to be willing to learn from our colleagues, even people from different professions within the healthcare itself, and we have to communicate effectively with our patients as well, especially during this period of uncertainty. I'm sure most of them would feel anxious, and especially more so during this period compared to others, and we have to be adaptable to how we can change our workflow, etc. So yeah, but ultimately I feel that everyone who's going to apply for the healthcare scholarship should have passion to serve and a heart to serve as well.
Thank you, Sarah. Since you're on, there's a question regarding career progressions for diagnostic radiographers. Could you share on that?
Yeah, sure. So basically, when you first start off after graduation, for myself, most of us would start maybe about 1 or 2 years to actually develop our foundation in general x-rays. So like what I mentioned before, radiography is not just about general x-rays. There's CT, there's MRI, ultrasound, nuclear medicine, and ultrasound itself. So all these are different modalities of radiology. So after your first 2 years, you would sort of be given the option to choose your modality, sort of a specialty, so to say. And then thereafter, there are also other career pathways for you. There can be education. You can choose to stay in a clinical setting where you serve your patients, or you can choose to be in management, or you can even choose to be in research as well. So there's really a broad range of career pathways for our potential scholars.
Thank you, Sarah. This is a question for Felicia. This is more towards physiotherapy. So the question is, with regards to physiotherapy, I heard that occupational therapists work closely with the physiotherapists. So could you share with us how often do you work with physiotherapists, and how would both professionals work in the same clinical settings while treating a patient? So a two-part question.
Yeah, no, that's the answer. Okay, so we work. PTs and OTs work very closely together. In fact, we work with them every day. many times a day. And one example of how we work together would be, for example, if the client wants to go back to work, and the client maybe has got a hip fracture, and at the moment, still has got not very good balance. So the PT would start working on that client first and strengthen that client's balance, endurance, strength, and in the lower limb. And then after that, I would be working with the client to go out into the community and do comm integration, comm mob, and see if the client is able to cope, and then come back and I'll discuss with the PT again what went well, what didn't go so well during the session, and then we will try to troubleshoot. Yeah.
Thank you, Felicia. I have a question from Ms. Nava. So we noted that you are currently furthering your studies. Could you just share with us on the career progressions for a nurse? Sorry, Nava, I think you're still muted.
Okay, sorry.
No worries.
So sorry. Okay, so basically, after you pass out, actually as a nurse, you'll be a staff nurse. So that is definitely after you have finished your diploma or degree. So after a staff nurse, you progress into a senior staff nurse once, probably around 3 years. That's also based on your performance. And then after that, after senior staff nurse, you will progress on to senior staff nurse clinical, meaning to say that you're more skilled in the clinical side of nursing, and then so on and so forth, where you will become an assistant nurse clinician, and then a nurse clinician and senior nurse clinician, and you can further on to go into nursing director roles and so on and so forth. So yeah, that's basically the career progression. But of course, in between the progression, you have specialty nursing, which is like, for example, for where I am now is a cardio nurse. I mean, we are cardio specialized. So we have different specialties like heart failure nurse, and besides heart failure nurse, we have also nurses who are trained in INR, meaning to say to see how patient's blood is clotting. So in that sense, they will follow the doctors in this specialty, and also there are also other specialties like ACHD nurses, where they follow the congenital cases of cardio. So yeah, just that's basically it.
Thank you, Nava. Thanks. Sarah, we have a few questions regarding diagnostic radiography. So the first question is, why is there a growing demand for diagnostic radiographers?
Okay, I think in Singapore, right, because I study in Australia itself, so I noted that there's a growing need compared to, as in the amount of radiographers that we have in Singapore is currently a lot less than what we have in Australia. And I feel that this is because, right, now Singapore, we are undergoing the COVID pandemic and stuff like that. So radiography plays a very large role in actually sorting out the patients into whether they're COVID-free or whether they are COVID positive, apart from the swab test, of course. So from basically all the patients who come in with respiratory symptoms during this period of time, we will actually do chest x-rays for them. And this will help to see, this will help the clinicians see whether they have any signs of pneumonia, and thereafter we can put them in a separate ward, a separate area in a fever tent, so that they do not sort of contaminate other patients. And I feel that especially during this period, there was a growing need for radiographers. Even those who have retired or those who have taken a break from this profession itself, they are all coming back. And that's because of the need in the hospital itself. We have a lot of pandemic areas which require radiographers, and yeah, MRI, ultrasound, we are all like stepping up and ramping up our services as well. Yeah.
Thank you, Sarah. The second question is, what are the areas that radiographers can work at other than in hospitals?
I think there, apart from hospitals, is it? So there's
Yes.
actually clinical research as well. So for example, in A-Star, I guess, or even private hospitals, there are clinical research areas which involve the use of MRI, for example, in the study of psychology, or in terms of other healthcare related studies, but I'm not too sure about that myself either because I haven't explored into that yet. But yeah, I do think that there are research areas where you can step into as you further your career, I guess.
Thank you so much, Sarah. Question for Felicia. What made you choose community care? We understand that you came from private settings and, if I'm not wrong, public too. So why did you choose to come into the community care setting?
Actually, in public health, I was also in community. I kind of decided that ever since I was a student already, because I felt that in the hospitals, the restructured hospitals, is way too fast for me. You know, it's like on Friday I get to see them just before I leave for home, and then on Monday when I check the census, they're gone. Yeah, so yeah, that's too short for me. So I really enjoyed all my placements in the community setting. So yeah, it was quite natural for me to after that just look for a job in the community setting. Because I get to work with them for anything between a month to about 2 years. It's just nice for me, lah. Yeah.
Thank you, Felicia.
You get to do a lot more with them in the community also. You get to see a lot more things, not just work with them on strengthening. You get to do, like just now what I mentioned, you get to refer them to different areas, like go back to driving rehab or go back to work rehab. Yeah, so it's very meaningful.
What's the average length that you see each patient for?
Well, my young, old, and old patients, so that would be anything between 65 to 80 or 90. Yeah. For the age group, I'll see them anything between 6 months to about a year. The younger clients who come in because of some kind of repetitive disc injury or because of a fall, for those cases, I see them a lot shorter because they usually rushing to get back to work, and usually their prognosis is also better, so they get well a lot faster also. So maybe 3 months to about a year max.
Okay, thank you. Could you also share what's the difference between an occupational therapist and a physiotherapist?
Oh, I see the question was coming. Yeah, well, I think for PTs, they are very exercise focused, and OTs were very activity based kind of therapy. So typically, you see the physiotherapists put their patients on maybe an R bike, a recumbent bike, or a stepper, or a treadmill, or they would be lifting weights. But when you look over to the OT section, you'll be seeing them do things like gardening, making a cup of coffee for themselves, maybe, see whether they're able to sequence the activity properly. Yeah, and yeah, basically move back towards meaningful occupation. So for PT side, the exercise, it can be, it can sometimes be quite repetitive. But for the OT side, sometimes they may not even need to do any exercise at all. It will probably be like, maybe just sitting in their chair, or maybe just doing some reminiscence therapy, talking about the time when they were, when they were younger, and it was maybe during the Japanese occupation. Yeah, so we can OT do that even. So they're very different.
Thank you, Felicia. Question for Ms. Hannah. Thank you for sharing with us. As far as I know, podiatry is not a course available in Singapore. So may I ask, how did Ms. Hannah do research on finding the course overseas? So how did you come about studying in University of Southampton?
Okay, so yeah, it's true. Podiatry as a course is not offered in Singapore. So the only places that you can study podiatry and then work in Singapore is either in UK or in Australia. So I did research by talking to podiatrists, because I think that when I was going to study, there wasn't a lot of information out there. So I talked to some podiatrists, and also once I got the scholarship, actually I spoke to my scholarship officers who advised me based on the previous scholars that came through. So I think a lot of the podiatrists, local ones who work in Singapore, come from Australia. Some do come from UK. The difference is that in Australia it's a 4-year course for honours, and in UK it's 3 years honours unless you're studying in Scotland. So basically how I did my research was to talk to podiatrists and also go online to check the different universities, what they offer. So generally speaking, in Australia, most of the podiatrists study in either La Trobe, is seen as one of the better podiatry schools, or QUT. And then for UK, it is, of course, I would say it's my university, University of Southampton. Some also go to, I know a few who went to Queen Margaret University up in Scotland, but it's 4 years. So if you're asking like how I decided why UK and not Australia, is for a few reasons. So firstly, the UK intake is around this time of year, September, October, whereas the Australia intake is in February. So, and I finished my A-levels, got my results in March. So if I went to Australia, I would have to basically waste 1 year before I go into university, whereas if I went to UK, I could start that same year. So that was one of the consideration. Also the length of study. So I didn't want to have to study too long. So 3 years compared to 4 years, of course, I chose 3 years. Yes, and there might be a bit of difficulty. There is different application process. So for UK, you have to apply through UCAS, whereas for Australia, it's true, you have to just apply to the university directly. So I think if, for me personally, I wouldn't have considered studying podiatry if not for the scholarship, because it is an overseas course, it is very expensive. So thankfully, with the scholarship, definitely the finances are taken care of. It's a full scholarship. So, and also the scholarship helped to advise and also expedite my application to the UK university, because I think they found there's been a lot of Australian graduates who wanted a bit of diversity. So I had some help from the scholarship to help me speak to the university and also expedite the process. Yeah.
Thank you so much, Hannah. Could you also share what is the typical day like as a podiatrist?
So the typical day varies, depends what I'm doing. So right now at work, at least, I'm kind of doing a mixture of things. I'm not in any fixed area in a hospital. So if I'm doing clinic, it depends what clinic I'm doing. There are ulcer clinics, so I'm basically seeing a lot of wound cases, or I could be doing a biomechanic sports clinic where I'm seeing a lot of sporting injuries, or I could be doing general treatment, general clinic where I'm seeing a lot of hard skin, toenail problems, footwear problems, people come in with foot pain. Yeah, so it's a mix. And then if I'm doing inpatient, I'll be seeing a lot of post-op wounds, people who come in with a diabetic foot infection, more serious ones. Yeah, and then there are also podiatrists in the polyclinic in community care. So it doesn't mean all podiatrists only work in acute hospital. There are community roles as well where they deal with more step-down care. So they do see something similar to us, but maybe a bit more not as serious, not like fresh post-op wounds, maybe the aftercare, wound care, and footwear, insoles, offloading, that kind of thing. Yeah.
Thank you so much, Hannah. So before we wrap up this session, we would like to ask each of the panelists to share one word of advice, advice for any aspiring students who wish to join in the healthcare sector. So could we start with Sarah, please?
Okay, like what I mentioned before applying for the scholarship, I'm not too sure about now whether it's possible, but as much as possible, try and find out a bit more about the scholarship, about more of the profession that you are interested in. Sign up, if possible, for job shadowing opportunities in a healthcare setting before taking up the scholarship, because you'll find out that more than just serving out a bond and having your career planned out, being in healthcare really calls for a heart of passion and of service. So you wouldn't want to regret after applying, getting the scholarship, and then serving your bond that you realize that you're not cut out for it.
Thank you, Sarah. Nava, would you like? Nava, would you like to give your word of advice?
I think it's similar to what Sarah mentioned. Actually, I think it doesn't matter which job you're doing. Actually, be it like all of us here, podiatrist, diagnostic radiographer, occupational therapist, or even a nurse. So it really depends on your desire and your passion, and just a love for the people around you. I think you'll be able to fit the team of a medical team. Yeah. Okay.
Thank you, Nava. Hannah, yourself?
Hi, yeah, so I think nowadays people are asking more what, in terms of career, what is more fulfilling rather than what can earn me more money. People are looking more into fulfillment and meaning, because a career is something you're going to go into for, I don't know, 30, 40, 50 years. So you don't want something that, you know, you will burn out quickly in, you might get tired of or feel you're stuck in. So I think healthcare is really an area that there's a lot of growth, a lot of meaning, a lot of fulfillment in. So if that's what you're looking for, then it's probably a good fit for you. But before that, as what Sarah said, research thoroughly, maybe talk to people, find out more, and get as much exposure, experience. I think you definitely feel inadequate. You might feel, oh, I don't feel ready enough. It doesn't matter. I even after 2 years, I still feel there's lots to learn. So I think an open mind, teachable heart is very important as well. The heart to care for others. Yeah.
Thank you, Hannah. And lastly, Felicia, would you have your words of advice?
I think that those were all words of wisdom. Yeah, I totally agree with all. I think that healthcare is one place that where most of my friends, even doctors, share that sometimes they regret because they feel that they feel that they are not making enough money. But yeah, so therefore I think, like what the rest have said, really really go and find out and see if this is really the path that you want to take. And once you have decided, then I would say, don't give up. Always look back on why you decided to be a healthcare professional in the first place. Yeah, and persevere.
Thank you so much, Felicia. So now we'll use the remaining time for me to actually answer any scholarship questions that I see. I do see quite a lot of questions pertaining to the scholarship, but in the event we are unable to get to your questions before 3:45, do note that the MOH holdings and cluster representatives, they are available to take out any questions at the virtual healthcare scholarships booth after this webinar session. So I'll just go as quickly as I can, and hopefully I can answer as many as I can. So the first one is, are there any available scholarships for allied health overseas? Yes, definitely, because we do have quite a number of allied health professions that are available in Singapore, such as your podiatry, prosthetics, orthotics. We have optotics, so those that are not available in Singapore will be done overseas. The next one is, are there any scholarships available for podiatrists overseas? Yes, so I think that has been answered by Hannah already. Are there any scholarships for psychology or biomedical science? So for psychology, we do have a master's in clinical psychology. So that will be under our Healthcare Graduate Studies Award. So you do have to get a bachelor's in psychology before applying for the scholarship. As for biomedical science, unfortunately, that is not one of the disciplines that is covered under our scholarship. Scholarships available for overseas medicine, such as UK and Australia. So unfortunately, in Singapore right now, we do not have, at least under the healthcare sector, there isn't a scholarship for overseas medicine students. We do have a PSC medicine dentistry scholarship that will be for students who have already started their studies either at NUHS or NTU, and then you can apply for the PSC medicine dentistry scholarship after you have completed at least 1 year of studies. Okay, I'm going like a bullet train, so hopefully you'll be able to hear it. So The next one is, what is the requirement? Example, your GPA. I think requirements, eligibilities, your terms and benefits, everything can be found on our website. And also if you go to the media section of the virtual booth, we have a downloadable healthcare scholarship brochure that shows all the information that you need to know about the eligibility and terms and conditions of the scholarships. Okay. How many healthcare scholarships are given out every year? So in the past year, we gave out, so it's quite a good decent amount, and this is across all the different scholarships. So we have quite a number of scholarships under healthcare scholarships, and we do have quite a lot of disciplines too. So for last year, we have given out a ballpark figure of about 140 plus scholarships. So it's quite a healthy amount of scholarships that we do give out. Scholarships are open to foreigners? Unfortunately, no. It's open to Singaporeans and Singaporean PRs. Yes. After you have graduated and are back in Singapore, where do you choose to serve out your bond? So where you choose to serve out your bond is really dependent on your application form, where you rank your cluster of choice, after which you'll be posted to an institution whereby you'll be serving out your bond for the rest of your service commitment period. Okay, so I do note that we are crunched for time, and also I do know that there are quite a number of Q&A questions that are left unanswered, but not to worry, you can always join us at the virtual booth to ask your questions. Okay, so thank you so much for joining us today, and I hope that today's session was useful in helping you make an informed choice about scholarships and also a career choice. So we look forward to seeing you join the healthcare sector in future. Thank you so much.